Pavlik's maneuver is used. Locate fetal bag. Which of the following strategies can most help you as a nurse to enhance your ethical practice and client advocacy? Examining and clarifying your own values. Which of the following stages of dying is usually the final stage? Acceptance. Estrogen is given in the management of all of the following conditions except endometrial carcinoma. Ill health, malnutrition, and wasting as a result of chronic disease are all associated with cachexia. The act of getting things done through and with nursing staff is nursing management. The nursing priority of child with acute renal failure is focused on monitoring the intake and output chart. It refers to individual self-determination and freedom of choice is autonomy. What can help reduce a patient's anxiety and post-surgical pain? Preoperative teaching. On a home visit, you notice some dust on a vent in your client's room and on the windowsill. Which of the following methods would you teach the family to use for removing dust? Use a damp cloth to remove the dust. Pulse oximeter is a non-invasive method to assess the level of arterial oxygenation. The interpretation of the data collected about the patient represents the health problems of the patient. Which of the following is an intervention for a patient with chronic obstructive pulmonary disease? Pursed lip breathing. Tourniquet test is used in dengue. A safety device used to assist a dependent client from a bed to a chair is called a transfer gate belt. Which of the following is a hormonal contraceptive? Depo-Provera. Most important complication of peritoneal dialysis? Peritonitis. Oral pills should not be given to a woman with hypertension. Airborne precautions for a client with pulmonary tuberculosis has to be taken until the client has no longer the disease. Which one of the following is a common response expected in a patient with stroke to the change in body image? Depression. Hepatitis infection spreads by oral route. Researchers must be content to say that hypothesis is probably true. Applied nutrition program was introduced in the year 1963. Which disease mainly affects children under 5 and remains endemic in only 2 countries? Polio. Which of the following minerals should be taken by a child suffering from rickets? Calcium. Pregnancy test is based on estimation of the HCG hormone. Pentavalent vaccine will not protect the baby against the following disease. Polio. Kopelix spots are seen in typhoid. MMR vaccine given at the month of 15 months. The scientific method of study of human population is demography. The initial assessment of newborn is Upper score assessment. Which of the following is a cyanotic congenital heart disease with right to left shunting? Taga. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Respirations 28 shallow. In chickenpox, initially rashes appears on the trunk. You are cleaning a client's partial dentures, which have a metal clasp. Which of the following actions are best on your part? Place a washcloth in the sink where you are cleaning. Special pay for special work are the suggestion of which committee? Jungalwala Committee. The nurse positioning a client after surgery will take into account that the position, which most often predisposes a client to physiologic processes that suppress respiration, is which of the following positions? Supine. Respiratory center are stimulated by carbon dioxide. Which part of the eye is transplanted from the eyes that are donated? Cornea. Long arm cast type of plaster cast is used in the treatment of fracture of radius and ulnar bones. Which cardiac marker raised first in myocardial infarction? Myoglobin. How many doses of tablet syrup of deworming can be given to a child? Twice in a year. Which one of the following 4 clients is most likely to tolerate pain best? An athlete having a knee surgery to prolong his career. The scientific method of study of human population is demography. One of the reasons for impaired gas exchange is both A and B. Mosquito may fly up to 3 miles. Inadequate intake of which vitamin by the pregnant woman can cause neural tube defect in the child? Folic acid. In adults, normal endotracheal suction pressure 70 to 140 mm of Hg. When assessing the client's hair, you are especially looking for pediculosis capitis. If it is present, which of the following signs will you most likely find? Oval particles looking like dandruff on the hairs. Drugs used to relieve pain. Analgesics. Please like and subscribe to my channel and click the bell icon to get video